Good evening. Ladies and gentlemen, as Ms. Moore has previously stated, we do not wish for us to come across as unsympathetic toward the issue at hand, nor do we wish for you to disregard your emotions. We do realize how sensitive this topic is, but it is pertinent that we fix our current problem rationally. Receiving medical treatment is not the issue. Paying for the treatment is. However, a government-supported plan is neither a reasonable nor a sustainable way to change the face of healthcare and health insurance affordability. There are two major concerns that must be resolved before considering the effects of a public option. They involve the effects of a lack of tort reform, which has caused a dramatic increase in the cost of healthcare, and the effects of a pricing policy that indirectly causes one patient to pay for another patient's services. If these issues were resolved, a public option would prove to be unnecessary. In the past 10 years, there has been a dramatic increase in medical charges based on two primary reasons. Part of the reason is the necessity of physicians to hold malpractice insurance to cover the cost of extremely high monetary awards involving lawsuits over medical procedures. Medical practitioners must add money to their hourly rates to cover malpractice insurance. The other effect of high malpractice rates involves the number of tests medical practitioners perform to lessen their exposure to a lost malpractice case. The effects on a patient is that he or she must pay for these tests and must undergo the inconvenience and pain associated with them. The government has also allowed pricing policies for healthcare that has caused a disparity in the charges for identical services. The government has allowed Medicare and private insurance companies, which have leverage through their large pools of customers, to force medical practitioners to cut prices for those covered by insurance. This has caused a shortage in operational receivables, and the patients who pay out of pocket make up for that shortage. Because of high medical costs, there has been an increase in the use of emergency room visits. The cost of these services is very high compared to an office visit. However, the cost of emergency room visits are paid for by higher insurance costs and by welfare subsidies whose funds are borne through taxation. As with almost every political debate, the question of economic sustainability is presented. Proponents of the public option may argue that this option can and will successfully compete with the private sector. However, it is difficult to find examples where government-run programs compete with the private sector and win fairly. In the state of Indiana, 213 companies sell health insurance. Obviously, Indiana has a pretty healthy dose of competition. It is unnecessary to add one more plan into the mix. A public option could prove lethal to the private sector by undercutting private insurers. If the public option was not subsidized by tax dollars and the entire cost of the system was paid by recipients of its services, it is likely that the monthly premiums would not be less than private insurers, and that the number of people selecting the public option would actually decrease the pool of customers, causing an increase in the premiums provided by the private sector. However, if tax dollars did support the plan, like the pro side mentioned, it would simply cause an increase in the amount deducted from wages and income tax. Americans that are not covered by government programs already pay approximately $1,800 more per year to support those on government-run programs such as Medicare and HIP. The effects on a state level would be no different. A public option, while it may increase affordability, will not necessarily increase the number of people who elect to purchase insurance. Therefore, Indiana taxpayers will still be paying for those uninsured, and their funding is not unlimited. What is to keep them from leaving the state? Why would they want to pay twice for something that they already pay for themselves? As Ms. Moore spoke of the failing public option plan in Massachusetts. One of the main reasons that Massachusetts is having such an issue with their public option is a lack of government funding. State governments do not have an unlimited supply of money. They must divide funds and budget each aspect of public well-being. A public option in Indiana would do nothing but suck more funds from our government's budget. It is much more economical, constitutional, and rational to address the issues already at hand, as opposed to instating yet another financial headache. The vast majority of government officials have backgrounds in political science, history, and law. In fact, Indiana's General Assembly can only claim 2 doctors and 3 registered nurses. The private sector is filled with individuals who are experts in their specific fields. The areas of healthcare and health insurance are no different. When dealing with reforms that target the private sector, we believe it is important to leave these decisions up to the experts. As the biographies of the members of Indiana's General Assembly point out, we clearly do not have a panel of experts proposing these ideas. Healthcare should be administered by doctors and nurses who are focused on the public's health interests, not on the interests of the politicians in Indianapolis. As the 19th century economist Alfred Marshall wrote, a government could print a good edition of Shakespeare's works, but it could not get them written. A public option cannot and will not fix the real issues behind the cost of healthcare. The only way to control the problem and make healthcare truly affordable is to address each of these issues separately. If this were to be done, and done well, a public option would ultimately prove useless.
According to a 2008 AARP report, malpractice reform would only decrease costs by less than 0.5%. Furthermore, the Indiana government itself and the American Medical Association said that there is a 92% monopoly in the Gary area and a 89% monopoly in Anderson of healthcare. How then is ineffective reform like malpractice to fix this problem?
Your question was, how is ineffective reform like malpractice going to fix the problem? This was mentioned, that malpractice insurance needs to be reformed. The way that the government goes about mandating malpractice insurance and requiring each doctor to have it, something needs to be done by the government to ensure that private individuals do not have to make up for what is not being paid through insurance. A decrease is a decrease, and combined lots of little solutions equals a big change. Thank you.